of the most common things that we see in the office is complaints of nasal congestion or the inability to breathe through the nose. And a lot of the patients have had allergy treatment, they've had previous nasal or sinus surgery and are still experiencing constant nasal congestion. The reason for that may be that one of the areas of the nose has not been addressed, which is called the nasal valve, which simply is an area in the front of the nose that has loss of cartilage support and is causing narrowing of the nose, which then causes congestion. This procedure, through radiofrequency energy, allows us to reshape that cartilage to give more space to the inside of the nose and thereby relieve the nasal congestion. The nice thing about it, it's in the office. There is instantaneous relief of nasal congestion in most cases, and the final product, 4 to 6 weeks down the road, is usually permanent. It's really a relatively new and somewhat revolutionary way to treat nasal congestion.
My symptoms are I can't breathe through my nose, and that causes a lot of problems, from snoring, just even trying to eat properly. Sometimes, you know, you take a deep breath, and if it don't go through your nose, you end up swallowing things and choking. Exertion, it's really hard to do. I've been trying to do breathing exercises, and that requires you to breathe through your nose. And, well, if your nose is blocked up, you can't do it. And the breathing exercise is about relaxation and de-stressing. And at my age, when you have high blood pressure, that is important. And they explained to me when I was here what exactly he would be doing, how he would do it, and he felt it was one of the best things I could do. I've already did the turbulent, or where they cut away in your nose a little bit, deviated symptoms gone. He said this is the only thing left. And I've been this way for a couple years, and I feel I'll be a lot better person by having this procedure done.
All right, we're going to take our cotton out and we're going to make our injection sites and then we're going to do our treatment. And I'm going to set up a couple of things here. When we do the treatment, there'll be some gel on the treatment device. I will suck that out after we're done. It helps to, it's kind of like an ultrasound. It dissipates the energy across there so you don't burn, it doesn't burn anything.
Okay.
Thank you. Try and breathe through your mouth for me. Thank you. All right. Excellent. Okay, turn towards me. Right there. Perfect. Right there. Go. Breathe through your mouth.
Slow, steady breath through your mouth. You're doing great. Hang in there.
Sorry. You're fine. Stay right there. Move.
4 seconds left on this side. We'll be done with that side.
And that's one. Let's take a peek here. I'm going to clean it up. And bingo. We're already starting to make a difference. Alrighty. Let's do the next one. Is there stuff on here, Ken? Okay. I'm going to look here again so I can get my placement right. Good. Okay, go ahead. Think about your belly and not your nose. There you go. Sorry. You're fine. Doesn't bother me in the slightest. It's cooling down now. Good. Suction.
So, is the whole part of it?
No, it's just you.
Oh, okay.
Notice how you don't feel pain, you just sneeze?
Yeah.
So it's just that you've got a sensitive mucosa that notices irritation a little bit, so that's why you sneeze.
Oh, okay.
It's part of the deal, you're okay.
And look at all the space. Okay, we got one more right here, and we might touch the septum right there. Okay.
It's been blocked off so long.
Yep. There we go. Okay. Let's breathe slow, not so fast. There you go. Now you're doing it. Frickin' pro. Now I want you to do something for me here, real quick. I'm going to clean this up, the camera, and we'll take a quick picture, and then I'm going to have you try something.
Sure. I can tell the difference.
That's what I wanted to know. So hang on just a second here. Let's get ourselves up here and look at the difference in the opening we got there. I think we'll notice even more when I treat that bump on the septum. Now I'm going to do something. Now breathe. What do you think?
A lot better.
Okay, good. I'm going to treat one area on your septum here too. It's sticking out a little bit.
Okay. From the surgery.
Mm-hmm. Right there. Okay, here we go. It's going to hurt just a little bit. Just breathe nice and easy. You're doing fine. Breathe. Slow like you were. Perfect. Done. Okay, let's suck that out. That side's finished. Perfect. Now breathe. Big difference in there. Notice how you don't suck in anymore when you breathe through his nose. See, all the cartilages are stabilized on both sides. And that, my friend, is the end of that.
Well, I'm breathing a lot better, and it's starting a little bit doing it, but I'm glad I did it. I really am.
Big sniff out. Do that again. How's that feel?
Good. I haven't been able to do that for a while.
Yeah,
So, yes.
perfect. That's what we're looking for. That's one of the benefits that we find with this procedure is some of the things we do, the patients, it takes, proof is in the pudding. It takes a while for the healing process for them to realize the true benefits or the actual benefits, where this is immediate. Pretty every patient we've done so far is like a home run hit. They're thrilled. So I'm glad to hear it. It's, from our standpoint, it's great as a healthcare provider to do something for somebody that right away you know it's helping them out, benefiting them.